Back and thanks for staying with us. 358 new COVID-19 infections have been reported across the country. The National Institute for Communicable Diseases has also reported 24 new deaths in the latest 24-hour cycle. That takes the national death toll to 89,319. Active cases have fallen to below 17,000. To this now, healthcare workers who participated in the Sisonke Study at the beginning of the year will be eligible for booster shots from tomorrow. Sisonke has confirmed excellent vaccine effectiveness to prevent death, severe disease needing ICU and hospitalization during the waves when the Beta and Delta variants circulated. Data from Johnson & Johnson, however, shows the durability of vaccine effectiveness decrease after 8 months. Now, let's discuss this. We are now joined via Zoom by Dr. Lesley Bamford, Chief Director for Child Health Program and COVID-19 Team Leader. Dr. Bamford, thank you so much for your time this afternoon. Now, speak to us about boosters. You know, in the case where you've already had your shot, and in this case particularly, do booster shots actually work?
Well, I think there are many issues that we don't know the answers to, but increasingly we are seeing from evidence from clinical trials that there is some waning of the immunity that is provided by the vaccines. So a number of countries have already started providing booster doses. In South Africa, in terms of our main vaccine rollout, we are still very focused on reaching everyone, but particularly adults and particularly older adults. We're focused on vaccinating them, providing them with their initial doses of the vaccine. At the same time, we are obviously looking at booster doses and whether we need to be providing those booster doses. We don't anticipate we will be providing booster doses for the general population until next year, but we know that our healthcare workers were amongst the first to be, or were the first to be vaccinated in South Africa. So particularly healthcare workers who were vaccinated in February or March are getting to that 6 to 8 month period where there is some evidence that the protection provided by the J&J vaccine is waning. We also know that our healthcare workers are at high risk of COVID infection because of the job that they do. So we're therefore, with the South African Medical Research Council, embarking on what we're calling the Sisonke Booster Study, or Sisonke 2, where from this week, healthcare workers who were vaccinated as part of the Sisonke program will be offered a booster dose of the J&J vaccine.
Now, of course, you're talking about, people that have already received these shots earlier on in the year. So one wonders then, do booster shots need to be from the same manufacturer, Doctor?
Well, that's a very perhaps controversial or unclear issue. Certainly, up until now, the focus has been on what we call homologous boosting, providing an additional dose of the same vaccine. However, again, there is increasing evidence that heterologous boosting, or mixing doses, giving a dose of a different vaccine, is as effective and possibly in some cases more effective. So these are all questions that need to be answered. So we are taking things one step at a time. We are doing this boosting study, providing this booster as part of a study, as part of the process of understanding more the effectiveness of boosting, how much additional protection does that provide, and all of this information will assist us to make decisions about providing whether we need to provide booster doses and how we should go about doing that.
Now, Dr. Bamford, you mentioned that the general population will probably only get, or it will be necessary for them to get the booster shots around about next year. What's the thinking behind that? Is it because, we still are yet to vaccinate about 40% of the South African population?
Well, I think we can really divide it into two main reasons. So the first being, as you say, there is no doubt that the number one priority remains to reach as many adults as possible in South Africa, and particularly older adults who are the most vulnerable. So we need to be reaching those adults, and we can't really justify starting to provide booster doses before we have good coverage across the whole of the population. So that is the one reason. And then secondly, we would like to understand better the need for boosters in South Africa. So we need more evidence, more experience to understand whether we need to provide boosters, and as I say, if so, what would be the best way to do that. So we do anticipate that we will need to provide boosters, but just to stress that currently no decisions have been made as to the timing or the nature and how those boosters would need to be provided.
All right, Dr. Bamford, let's talk about this now. So we're seeing the numbers, the daily numbers of COVID infections, dramatically low. I mean, at the moment, the last reporting cycle is 358. And of course, we are still seeing, those deaths, 24 being reported. But what do these numbers tell us? Because we know with the health minister just before we went into elections saying that it will be very, very difficult to anticipate at this time if the election that we've just, conducted in this country will be super spreader events. You can only tell that after 2 weeks at least, following the elections. What are the numbers telling us now? And are we still likely to then see that fourth wave hit the country next month?
So the numbers currently do seem to are low, and we haven't seen a spike following the election. We are only 1 week out from the election, but I think we are fairly confident that even during the voting procedures, people followed the recommendations, and hopefully as a result of that, we will not see a spike as a result of the elections. The nature of the pandemic is that it comes in waves. It's difficult to predict exactly when those waves will come and how intense they will be. That depends on a number of factors, in particular whether a new variant emerges. So we are still concerned that we will experience a fourth wave. Perhaps it will come a little bit later than had been anticipated. But either way, we need to prepare for that wave that will almost inevitably come. And as we know, the best way that people can prepare is to be vaccinated. And so we understand that when the numbers are low, people may not feel the urgency to get vaccinated, but we would nevertheless really encourage them to come forward and be vaccinated. So whether the fourth wave comes next month or possibly comes a little bit later than had been anticipated, that if they have been vaccinated, they will be protected, particularly from severe disease.
What will likely happen should, South Africa experience a fourth wave, of COVID-19, just in terms of how we then start restricting movement as we've seen in the past? Are we at a stage now where, we could still live with another wave, possibly a new variant, as you've said, and still be on this current level that we are currently in?
So I think that's very difficult to predict, and it will, of course, depend perhaps on the timing, but more importantly on the intensity of the fourth wave. I think all of us would like to remain under level 1 as we currently are, But the reality is that if there is a wave and if the number of cases becomes very high, if there is a risk that our health facilities are going to become overwhelmed, then we may well need to move back to more restrictive regulations.
All right, fantastic. Dr. Bamford, thank you so much for your time this afternoon. Really do appreciate it.